Okay guys, let's talk about some anatomical terms because it's a whole lot easier to demonstrate this than to just talk about it. So we filled them in on the notes, but I encourage you to do this along. If I'm gonna act silly, you should do it too. It's good practice, helps you remember. Okay, so the first one is anterior. Anterior means in front of or towards the front surface. So here we're talking about the front of the body. So you could say that like the nose is anterior to the ears, or the heart is anterior to the spine. You can say that, so it just means in front of. So posterior would be towards the back. So we could say something like the kidneys are posterior to the large intestine. We could say that the gallbladder is posterior to the liver. You know, if we're looking at me, we could say that my spine is posterior to my chin, things like that. So here, you know, posterior, anterior, front, posterior, back. All right, next, dorsal and ventral. Think like a fish here, okay? So you're gonna think kind of like a shark. Look for the dorsal fin in the water. We all, hopefully you've seen Jaws. Hopefully you're old enough to have seen Jaws at some point. But anyway, all right. So dorsal is also going to mean towards the back. So we're kind of thinking like the back, like where we would have like a fin. So think like you're swimming here. All right. So the things that are in the back. The scapula. So your shoulder blades. Those are going to be on the dorsal side of the body. So kind of like a region of the body. So the dorsal, we're going to think about things that are in the back. So like the vertebra are on the dorsal side of the body. Versus ventral, that's going to be the belly side. So things are going to be on the belly side. In this case, you can say, so like your belly button is on the ventral side of the body. If you're talking about a female, mammary tissue on the ventral side of the body. So think about the belly side here. We're generally talking about the torso, so back versus belly. All right, so dorsal, ventral. I'm gonna come up with a dance or something. All right, next, let's talk about top and bottom. So we have superior, it's gonna be closer to the head, versus inferior, closer to the feet. So we could say my shoulders are superior to my hips. We could say that my knees are inferior to my ribs. So towards the top, superior, towards the bottom, towards the feet, bottom of the feet, inferior. All right, cranial and caudal. So you kind of have to think like a pig here is kind of how I learned it. All right, so imagine like being down on all fours. I'm not gonna do that, mostly because I have to move the camera. But all right, so think about being down on all fours here. So cranial, obviously we're gonna mean towards the head. Caudal, think about a cute little pig with a tail. So here we're gonna talk about the tail end of the body. So, you know, like down here at the base of the spinal cord, you know, it comes unwrapped and you've got the cauda equina, where the spinal cord, you know, kind of does that. We'll talk about that later. But so like we could say that my shoulders are cranial to my belly button, you know. We could say that, so here we're going to talk about towards the rear or the tail end. So now the tail end of a person represents the bottom, not the feet. Okay, so that's the feet. This is the rear. We all know what a rear is. All right, so we could say that the glutes are caudal to the let's see, something is in front, the rectus abdominis, so the abs. So glutes caudal to the abs. Makes sense. All right, now let's divide the body down the center here. So we're going to do a medial plane, medial section here. All right, so when you have medial, that's going to be towards this imaginary midline of the body. So this imaginary line that I have drawn right down my middle. All right, so versus lateral. Lateral means away from the midline. So if we're talking about anatomical position, here, this is anatomical position. It's if you do yoga, it's like mountain pose. Is exactly what anatomical position is. So palms out, forward. Okay, now, so medial and lateral. All right, so let's see here. Towards the midline. The heart would be medial to the shoulder, or the elbow would be lateral to my belly button. So away from the midline. Generally, we think about these in terms of movement. So when you move something laterally, we talk about this in AMP too. So lateral movement away from the midline, medial movement towards the midline. So kind of do that. So this would be lateral movement, medial movement, directions there. All right, next we have superficial and deep. Okay, so superficial refers to like towards the skin surface, versus deep, which is going to be under something else. Think like deep tissue. You know, you have like your nice little Swedish massage here. That's very superficial, versus a deep tissue massage where they're really like digging down, stimulating those deeper tissues. So we're going to think about things that are under other things. All right, so here we talked about the serous membranes. So we have serous membranes of the lungs. They're going to be superficial to the lungs. So because they're on the outside, the lungs are deeper. So what else? Things that are under. Let's see. The gallbladder is deep to the liver because it's under the liver. All right, let's see. And now we're going to talk about dealing with appendages, proximal and distal. All right, so proximal, we're going to say how close is it to the point of attachment to the trunk. We're talking about limbs here. So we have 4 limbs, so there's 4 points of attachment. So we have 2 shoulders and 2 hips. All right, so how close to one of these 4 points? Proximal means closer to this point of attachment. Distal means further away. So proximal would be elbow, distal would be wrist. You know, you'll talk about proximal phalangeal joints there. So that's going to be here. We're talking about tips of fingers versus knuckles. So proximal further away. Proximal closer to, distal further away. Proximal phalangeal, distal phalangeal. Let's see, what else do we have? And then on the legs, you know, so we would have like ankles would be distal to knees. Knees are more proximal than ankles. So hopefully that kind of gets you a little bit more oriented to how things move and how things are positioned.